we want to talk a little bit about positioning of the patient. We always want to, think about, should they be sitting up or should they be laying back? And I get that question a lot. With doctors, and those of you that are lucky, a lot of times, if we're tall, then we can really get up and over the patient. But most females, let's be honest, are not that tall. So it makes it really tough for us to get in the mouth and get all the teeth in the frame. And again, a lot of times what we see is in those mirror shots that we've cut off the last molar. So we don't want to do that. We want to make sure that we get every tooth in the frame, because when we're talking to patients about communication and also treatment planning, we really want to make sure we have every tooth, right? Not just cutting it off at the first molars. That starts with positioning. So if Kylie here is sitting straight up and I try to take my photos in front of her, I'm going to get a double image, and it makes it really tough to get in there. A lot of us were trained that way because a lot of dentists do that. But personally, I have found that my photos were totally different when I lay the patient back. And so I want to demonstrate that for you now. So what I want to go through first is just thinking about positioning the patient in the chair. Notice that Kylie is still kind of at an angle and not quite to my waist. This is really important. Again, going back to we're used to taking the photos from in front, right? That's not what we want to do. So you want to think about your chair and how far back you can get it. Now, I don't want it to be lower than the feet, but I do want it to be at my waist. The other thing is a lot of us have pretty small ops like we do today. And if you need to unlock the chair and turn it so you can get behind them, because remember, we've got a lot of equipment right behind us, right? So we want to move that chair and be in the right position. So notice now we've laid the chair back. With Kylie, we probably lay it back just a little bit more, but I wanted to kind of share that with you, that going back to what we talked about, we're females, most of us, sorry, males, but females, we're a little bit shorter, and we really want to be able to get behind the patient. Remember, up and over. And when we've got all this equipment too, sometimes we may have to unlock the chair and move the patient just based upon the room size. So I'm going to lay Kylie back just a little bit more, and let's talk about where she should be in the chair. The other thing that I want to just mention now is I'm going to have Kylie come up a little bit more on the chair. And the reason being is a couple of reasons. When the patient lays back, the higher they lift their chin, the further back the tongue is going to go, because we know a lot of patients have that wild tongue. Is like an animal, right? So we want to make sure that, again, the higher she lifts her chin, the further back the tongue is going to go, and I'm going to be able to put my mirror in, and I want to demonstrate that because a lot of times these mirrors are wide, and we've got a little segment at the end where we talk about retractors and mirrors. But I want to, again, make sure you're going to lay them back, you're going to get behind them, it's right at your waist or a little bit lower, and that we're positioning ourselves where we need to be. So remembering our settings, this is going to be on a manual, right? I'm going to roll that dial down on the lens to 1 to 3, so every photo is the same, right? Absolutely every photo. I also have, and remember, we went from full face to inside the mouth, and so I've got my f-stop, and you can go back and forth. You need to judge the room and really looking at your camera because they're all a little bit different. If we were in a room that had a lot of light, we really want to make sure we're taking the photo and really looking at it on the computer as to what that looks like. And a lot of times I'll do that and have the doctor look at it to see if we really want to alter it. Remember, our goal is to not have to crop, not have to Photoshop, right? Get it right the first time. Today, what I'm going to do is I'm going to be shooting on a 22 with my camera, and I'll show you the difference a little bit later on how that looks as you go up, all right? So notice that, again, I'm up and over Kylie. I'm going to grab my retractors. We, again, want to make sure this is not utilizing a plastic, retractor. Here, what we're going to do is be utilizing wire. And you'll see the difference because we can get in there and pull the lips out of the way, all right? So I'm going to just slip these in. And remember, Kylie is our assistant. And Kylie, bring your hands up just a little bit closer, okay? Got it? So a lot of times when we're asking the patient to do that, they're going to move around and they're going to probably take their chin just like she did and bring it back down, right? Remember, high chin, tongue go back. So I've got my mirror. Notice it's got the rubber end to it that we talked about. I'm going to slip the mirror in, and some people will say, well, Shannon, how do you keep it from getting fogged? Don't waste any time. As you take more photos, you'll see that it'll be easy and you won't have to utilize a warmer or hot water. I want to make it as easy as we can. We've got the wire retractors in. Notice they're at a V, not straight across, okay? She's my assistant. I love these because they're long and she can grab a hold at the end. Going back, lifting your chin as high as you can, and I'm going to slip the mirror in, okay? So I've got my mirror. I'm going to get my camera ready before I do it, right? Get my mirror in there, and I'm going to move my body in and out. Open really wide, Kylie, as wide as you can. Now, one of the things about Kylie that I'm going to just make sure that you know is she's got a really small mouth, and I'm seeing so much of all the tissues and surrounding dentition that she has. So we talk about being on a 1 to 3 on the line. I'm going to come in just a little bit more because I don't want to, have to crop. On her, I probably would have to because, again, she's got a small mouth. So I'm going to come in just a little bit more on her so this way I can see more and not have to see as much tissue. So I'm going to slip this in, Kylie, and I'm going to push just a little bit on you, okay? So now I'm going to come in front because we're going to get the mandibular arch, and I want to just mention just 2 things. Notice where Kylie still has the retractors. Now what we're going to do is just kind of bring them around. There we go. And you hold them again like you did earlier. Having them grasp the end of it will help us to be able to pull that back. The other thing is I just want to make sure that I'm positioning it. Why do I have it at a V? Going back to if they're straight across, the lip is going to collapse, right? The other thing is I don't want my focus to be on the retractors. The patient also can hold them. And a lot of times patients will pull the lips out of the way a lot further than we will. So I want to make sure of that. The second thing is notice where I am. We're always going to stay on that right side, no matter if you are, or say right side for the chair, no matter if you're right-handed or left-handed. Now, the other thing is notice, what do I have? This is where assistants get, kind of scared holding these cameras. It's a little bit intimidating, but I got a strap. I can't tell you how many, over 50% of the team members that I've taught with photography don't have a strap. This is security. So if I accidentally dropped it for any reason, I hit the patient, not the floor. And so in our practice, if you do that, that's a PD, a payroll deduction, all right? So don't do that. And it's a security blanket. It gives me security. The next thing is while I'm here, I also want to make sure, and I'm going to just get in close here, if my ring flash, if you're utilizing a ring flash, if it's turned this way, okay, you see how it's turned, I'm automatically going to go just like this. And sometimes what we find is we're going to go in at an angle. And what we noticed was that was because the ring flash wasn't dead in the center. Again, a little bit heavy. We're going to lean towards the right if it's tilted. All right, so that's a quick tip for today. Now I'm going to just kind of grab it, turn it back around, making sure it's nice and straight. Go back to the setting, same setting. Don't touch the dial. We're always wanting to dial it in. Make sure you don't move it. I've got my mirror, okay, and Kylie has been so patient. Now, same thing. Kylie, lift your chin, not too high, okay? I'm going to make sure that I got a good stance. Notice I'm going to put a foot down so I don't kind of lean and bobble over the patient. And I've got a good stance. I'm going to have you turn your head just a hair towards me, okay? And again, coming down, you see how she's moved the retractors up just a little bit further. There we go, okay? So I'm going to slip that mirror in, and Kylie, turn towards me just a little bit more. Turn towards wide, a little bit. There we go. Really wide. Beautiful. And you heard that little toot-toot. That kind of tells us that we are in focus. Always listen for that. Toot-toot. That's one of the things that I love about the Canon is that it kind of gives us, now don't depend on it, but I know I'm in the right place. So let's take a look at that photo. And again, she's got a real small mouth, so don't beat yourself up too much on this one. If she was adult, I would make sure nothing's in the way, but because her mouth is really small, again, we might want to adjust that, that setting on the lens. So let's look at that really quickly so you can see we got everything in the frame. And notice I did not cut off her last molars. Now Kylie's got a class 3 bite. She's the reason why we're going to go through orthodontic treatment. So I had to kind of turn her towards me because her lower arch kind of goes a little bit to the right, okay? So when that happens, I want to line it up, but sometimes I'll have to have her turn her head or have the patient turn their head towards me. So this is the hardest shots to get, very tough. But again, just go back on a couple of those tips real quick. The first thing is lay in the chair back far enough where you can get up and over the patient, okay? Up and over. The retractors, we've got wire retractors, not plastic, not the Optrogate. I love the Optrogate, but you know, that is something that's going to be white. Nothing, again, as far as mirrors go, you don't want to just use some mirror that you really don't have a hold of, which is why I love these, because it's rubber, right? My hand's not going to slip, and we'll go over all those mirrors a little bit later. But positioning, putting the retractors in, and you being in the right place is what's going to allow you to get the best images. So 2 tips that I want to touch on. We use the wire retractors, and the best thing about the wire retractors is that it allows us to pull the lips up and pull the lips down. Let's say you did not, or you are not able to utilize the wire retractors. Let me show you what happens when you don't. If I was to have Kylie use the same retractors, and trust me, yes, I see this. Oh my gosh, it makes it so hard for you to get the best images. And most importantly, they can't open as wide, so you're going to get a double image. The lower teeth, you know, again, even worse, okay, the lower arch. So let me just show you really quickly what that would look like if we slip those in. And I'm going to just kind of put them in. She does have a small mouth, but I'm just going to kind of put these in. Let me just show you how hard it's going to be. Do you see? The best photographer, and I see this, is not going to be able to get it. Even worse is when we think about another set of retractors that would look like this. And these are like the most famous, and these are horrible. We're going to slip it in and try to get it again. May work, again, on Kylie because she's small and younger, but not on an adult. They're going to touch in the center. We don't want that. The best image is going to be those wire retractors. The other thing that I want to mention is what happens if you're not really practicing taking the photos. Remember, practice is going to make perfect. You can't just shoot one patient a week and think that you're going to be really good at it. So every day, taking photos, critiquing each other, really important. But let me show you a quick tip. So one of the things that we know is we can utilize a heating pad. We can utilize hot water. Now PhotoMed has a little, almost like a little suitcase that you could put them in the morning. Can I tell you, the more photos that you take, you won't need any of that. The other thing is talking to the patient as you're taking these photos. Very, very valuable. You heard me say, lift your head really far. Okay, Kyle, we'll move your head. You know, just kind of telling them what you want is going to make, you know, you've got to move them and giving them direction. Patients will do that. But let me show you what happens. I'm going to slip these back in, and I'm just going to kind of have you hold these for me one more time, Kylie, okay? Actually, it's probably better if I show the lower arch. So this way you guys can really see it. Notice her hands, the further outside, come down just a little bit more on those retractors. The further down, I love the fact that this is long. If you're going to order wire retractors, don't get the short ones because sometimes females got long fingernails, right? And I always wonder, what's in the frame? It was their fingernails. So longer fingernails where they can grab it and slide just a hair. Again, I'm giving her direction, right? Let's talk about that really quickly. I want to troubleshoot this with you, and I want you to see it. You want to get in there, lift your head just a hair for me, Kylie, and really get in there to take the photo. You see how quick, wide, 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 wide? And I'm able to get that. No fog. Really important, right? Get in there and get it. No fog on that frame. I want to end with talking to doctors who are watching this module. We hear so many times that the team will tell me, Shannon, the doctor won't let me take the photos. I want you to think about how unproductive that is. If you train your team, what we find is the team actually takes better photos than the dentist. And it's true. But we also have to have encouragement, and we need to troubleshoot, and you need to tell me what's wrong with those photos. When we have team meetings or staff meetings, we don't want to always talk about numbers and production. Change it up a little bit and go to some clinical information, some clinical training. Have your team take photos, print them out, critique them, because if you never tell me what's wrong, I'm never going to correct it. And I want your photos to be perfect. We're going to share with you some really bad photos and talk to you about how can we make those look better and what are some of the things that we did wrong. But most importantly, let that camera go. These team members will probably be better at it than you will. So doctors, let that camera go. Also, if you need retractors, mirrors, anything that you really need to do or utilize to make your life easier, we have those on our website. And we're going to have that information and most importantly, where to go and get everything that you need to take the best photography possible. I'm Shannon Brinker. I thank you so much. I hope to see you again at another one of our training modules.